This presentation is about quality management dental care based on analysis of judicial practice. At the beginning, a few words about an author. Andreeva Svetlana Nikolaevna has been involved in legal proceedings for 15 years as a representative of the clinic and as a forensic medical expert. The data presented in the report was obtained by analyzing 3,500 court cases from 2013 to 2023. In addition, Andreeva has been the head of a large federal dental clinic and maxillofacial hospital for more than 10 years. In recent years, patients have been more likely to go to court when they are dissatisfied with their treatment. Therefore, analyzing negative treatment outcomes has become necessary for changes in the organization of work. At the beginning of the study, it's important to understand what constitutes the quality of dental care. In the Russian Federation, the quality of medical care is determined by three main criteria: the timelines of medical care, the correctness of the choice and execution of treatment methods, the degree of achievement of the planned treatment results. These parameters define the criteria for assigning the quality of dental care in our country. The parameters are ensuring the availability of medical care, compliance with the terms of treatment and the production of dental prostheses, implementation of treatment methods, providing evidence of good results of dental treatment. We must know the laws and take into account the opinions of all parties involved, experts, doctors, and patients. Different views on the quality of treatment can lead to conflicts. An expert accepts high-quality treatment as a compliance with norms and rules. High-quality treatment for a doctor is to achieve the best result for the patient, taking into account the severity of the pathology, available resources, and materials. And the patient wants dental treatment to be fast and pain-free, new teeth to be beautiful and inexpensive. We all understand that it's better to prevent a conflict than to resolve it. This is because the consequences of conflicts in dentistry include lengthy legal proceedings and reputational, time, and financial losses for the clinic. The number of court cases involving dentists is constantly increasing. In the early 20th century, several dozen cases involving dentists were considered in the country each year. Currently, there are more than 500 court cases involving poor quality dental care each year. It's important for dentists that the number of not only civil cases but also criminal cases against doctors is increasing. Not all cases reach out court, but this trend is distressing. We have analyzed the structure of court cases involving medical specialties. The share of dentists in Russia is 9% of all doctors. At the same time, dentistry is in second place in Russia in terms of the number of court cases. Thoracic surgeons and anesthesiologists are in the first place. This number of court cases involving dentists is due to the large volume of paid medical care that's provided outside of state and insurance programs. We have conducted an analysis of the outcomes of court cases. The court confirmed the presence of defects in dental treatment in a large number of cases. In 4% of cases, the country fully satisfied the patient's claims and found the dentistry guilty. In 50% of cases, the court also found defects in the treatment and partly satisfied the patient's claims. In every second case, dental clinics were unable to prove that the treatment was performed correctly and that there were no defects. Later, we decided to identify the specialty with the highest professional risks. This is important for professional liability insurance. It has been determined that it's impossible to single out a single specialty. In forensic medical examinations, dental treatment performed by multiple dentists was often evaluated. This is the main characteristic of dental cases in court. Treatments is carried out by a team of specialists. It's difficult for experts to determine the extent of each doctor's responsibility for the final outcome of dental treatment. This is displayed on the slide, but we counted how often specialties are mentioned in court proceedings. Claims against prosthodontics are contained in 40% of court cases. In 31% of cases, the work of dental therapists was reviewed. Claims against the work of surgical dentists were presented in 25% of the cases. Claims against the work of orthodontists were presented in 3% of the cases. The number of court cases involving the treatment of children is 1%. In cases where the court confirmed the existence of medical malpractice, compensation payments were made. These payments varied in size for dental clinics. This slide shows the ratio of payments to the cost of the treatment itself. In other words, how many times the payment from the dental clinic was greater than the cost of the treatment performed. Payments from dental surgeons were almost 100 times greater than the cost of the treatment. Payments from orthodontists were 8 to 9 times greater than the cost of treatment. Dentist surgeons receive the largest payments. This is because if medical care is found to be defective, the guilty clinic must correct the treatment. If a tooth is removed incorrectly, the clinic must pay for the installation of a dental implant and prosthetics. The calculation was based on 3,500 dental court cases. The main payments by court decision were highlighted and analyzed. All the main payments are given on the slide. The most significant payments were related to compensation for non-pecuniary damage. Compensation is requested by patients in 96% of lawsuits. In 52% of cases, this requirement was satisfied by the court. The amount of compensation for non-pecuniary damage in dental implantation in 30% of cases was from $10,000 to $50,000. Patients demanded reimbursement of previously paid treatment in 73% of claims. Penalties for the refusal of clinics to resolve the conflict before the court were demanded in 35% of claims. Let's formulate the main features of dental court practice. At first, our patients always request a compensation for non-pecuniary damage. In cases related to dental implantation, compensations is requested in 100% of cases. In other dental cases, compensation is requested in 96% of cases. These payments are significant in size. Secondly, a forensic medical examination is always conducted. Thirdly, in the Russian Federation, there is no statute of limitation for claims of harm to health. Patients can file a claim even 20 or 50 years later. We had a precedent where a patient filed a lawsuit 20 years after receiving dental treatment. The patient accused the doctor of causing harm to health by providing incorrect orthodontic treatment. The patient believed that the effects of this treatment manifested themselves 20 years after the treatment. Forensic medical examinations are conducted 3 to 4 years later, and sometimes 4 to 10 years later. Experts evaluate the quality of treatment and medical records many years after the treatment was performed. It's difficult to take into account the influence of time, somatic diseases, and the quality of prosthetic care on the results that experts evaluate. Also, doctors are not subject to the presumption of innocence. The patient does not have to prove that there were defects in the treatment. Dental clinics must prove in court that the treatment was correct. Also, in dentistry, there is a high risk of patients' simulation or aggravation of symptoms. For example, one of our patients demanded compensation of several million rubles for improperly installed implants. However, he had been using a prosthetic device for many years and refused to replace it. It's difficult to assess the harm to his health when it's impossible to quantify the damage. There are more features. It is difficult to assess the aesthetics of prosthesis. In courts, a case was considered the production of veneers on the upper and lower jaw. The patient was made 8 different options of veneers on 2 jaws, but none of the options satisfied him in appearance. Experts use objective assessments, but people's opinion about the beauty of a smile and teeth vary greatly. An important feature of dental court cases is the lack of established juridical practice regarding the possibility of dividing a dental service into separate treatments provided by different specialists. In some cases, the court determined that the entire dental treatment is considered a single service, while in others, they allow for the separation of therapeutic, surgical, and orthopedic components. Finally, there are problems related to medical tourism when different stages of treatment are carried out in different regions of the country. In such cases, it is difficult to determine which clinic made a mistake in treatment. This requires certain measures from the clinic administration to ensure continuity in treatment and legal compilation of contracts. There are still problems. Not all situations are defined by law. For example, there is no clear definition of the end of dental treatment for chronic dental diseases or for fixing dentures with temporary cement. It is important for the head of the clinic to know where the most serious problems are occurring. An analysis of 3,500 court cases showed that 23% of complaints were related to the organization of the treatment process, the work of the staff, and the comfort of staying at the clinic. This is a crucial point for risk management. Changing the qualifications of a dentist and introducing new treatment technologies requires time and financial investment. Changing the organizational of work only requires understanding the problems and solving them correctly. Therefore, we conducted a dental analysis of the main complaints of patients regarding the quality of dental care. The slide highlights the main components of complaints regarding the organization of the treatment process. These include a lack of interaction with the patient, such as failure to provide documents, certificates, or explanation about complications. Also, a lack of discussion about the treatment plan and a lack of coordination of change in the treatment plan. This slide shows the proportion of all complaints that made up the group of complaints about the organization of a dental care. I'll spend a few minutes for you to be able to look at this slide. So we're going to the next slide. And among the main reasons for going to the court, 7% of patients cited improper treatment planning. Of these 3.5 of patients believed that the doctor had not used all of the implant methods, so they made a wrong diagnosis. 2.1% of patients in court complained that they had not been given a treatment plan. They hadn't been told how many teeth would be removed, what kind of dentures they could choose, or what material to use. There were complaints that the clinic did not provide any certificates or test results. When organizing the clinic work, we decided to visualize the treatment plan and agree on the stage of treatment, the timing, and the cost of treatment with the patient in writing. We have identified the reasons for patients' appeals to the courts. This has led to the implementation of several measures to reduce the risk of conflict situations. To improve the quality of medical documentation, we have developed electronic templates for all stages of treatment and nosological forms. One of the advantages of this solution is the easy monitoring of the quality of medical records. Doctors' records have become more comprehensive, accurate, and in line with legal requirements. Templates can be quickly changed centrally if legal requirements have changed. To solve communicational problems, scripts for doctors' behavior in non-standard situations have been also developed. This script helps doctors to control the situation when complications occur. When a doctor knows exactly what they should do, conflicts are less likely to occur. Work has been carried out with the team so that doctors do not hide their problems with patients, but report them to the administration. The clinic administration has more experience and resources to solve the problem. To address the issue of medical document provision, a simple algorithm for requests and responses to patient has been created. All requests and responses can be received electronically. The patient doesn't waste time visiting the clinic, and the administration has time to make an optimal decision. Administrators have been assigned additional responsibilities for documenting proceeding and patient support. The official website of the clinic and the clinic premises contain information about the rules of interaction. The patient clearly knows their rights and how to use them. We tell the patient what to do if a filling falls out, if there is a pain under a denture, and how dental treatment carries work, or how dental warranties work. Thus, by studying the data of juridical practice on each point, work was carried out to improve the quality of management in the organization. As a result, we have several times reduced the number of complaints. We organized the correct logistics of paperwork accompanying the treatment, visualized the treatment plan, created electronic informational channels for the patient, for the patients, made the stage of treatment more open and understandable for patients. The administration was able to objectively control the quality of the provided dental care. This reduced the number of claims from insurance companies. Doctors began to spend less time on the registration of medical cards. The quality of records has significantly improved. We are currently working on improving electronic system, and also this will improve the quality of dental care by preserving information. So this is the end of the speech. I hope everyone liked it. Now, if anyone has questions, I can translate them to Svetlana Nikolaevna and she'll answer you back.